The underlying cause of the healthcare crisis is a fundamental economic principle that's been completely overlooked. It's an absence of price competition. And the more you think about it, the more you realize this is true. When's the last time you saw the price of a procedure or a cardiology consult or a hospital stay or the price of a drug advertised? It never happens. It's simply not part of the process. Price competition does not exist in this market. And that's the reason prices have risen to such extreme heights. The unusual thing about this is that absences of price competition are usually created by monopoly powers or price fixing agreements. This absence of price competition exists simply because the stimulus for price competition to develop in this market is absent. The thrifty consumer has been replaced by a non-thrifty decision maker. Therefore, price competition never develops. So it's no one's fault. It's simply the way the market is designed. And that may seem more benign at first glance, but actually it's much more malignant, because under monopoly powers or price fixing agreements, they could keep a lid on inflation. They could say, we have to stop increasing prices or we're going to attract too much government attention, or we're going to kill the goose that lays the golden egg, so to speak. This absence of price competition is uncontrolled. No one can put a lid on it, and it amounts to price cancer in the market. It's uncontrolled growth. And just as cancer kills the host, this is going to kill free market health care. Or else it'll drive us to socialized medicine if we don't enact the reforms that I'm talking about. Now, under socialized medicine, the government could put a cap on prices and stop inflation that way, but that's a very clumsy, inefficient, and repressive method of control. It would be much better to correct the problems with the market so that price competition could develop and prices could be driven down. And just another note about the effects of price competition on the market. In a properly functioning free market, suppliers are forced by price competition to operate efficiently. In fact, only the most efficient suppliers are left. In healthcare, it's easier for suppliers to increase their price than it is to become more efficient, because again, it doesn't drive away business. And also in a properly functioning market, suppliers have an incentive to find the most cost-effective technology, because a market exists for more cost-effective products. In healthcare, no market exists for more cost-effective technology unless it's at least equally therapeutic, because the doctor doesn't have the incentive to prescribe the second best product or service, no matter how inexpensive it is. Therefore, research in healthcare is driven to produce only the most advanced products and services instead of more cost-effective treatment options. This is a major factor in the high cost of medical technology. Altogether, 3 of the 4 major factors in the healthcare crisis are the direct result of an absence of price competition. Inflation in healthcare costs, because suppliers can basically choose whatever they want as long as the doctor's inclined to buy or to prescribe their product. Waste and inefficiency, because suppliers are not forced through price competition to become more efficient. And the cost of medical technology, because no market exists for more cost-effective options. Now, before I go on to any of the other factors involved in the healthcare crisis, let's address these, because if we can solve these, we're a long way ahead in solving the healthcare crisis. In order to generate price competition, and that's what's lacking in the market, it's necessary to combine the role of decision maker and payer, resulting in buying behavior like that of properly functioning markets. In other words, we have to create a decision maker that has a financial incentive to choose the most cost-effective products and services out there. That's what forces price competition on the suppliers in that particular market. The doctor is the most qualified to make healthcare decisions, but it creates an unacceptable conflict of interest for him to have a financial incentive to spend less on a patient's healthcare. For example, you wouldn't want to go to a doctor if you knew that in the back of his mind, he's trying to figure out how much money he can make for himself if he chooses less expensive options for you. That's an unacceptable conflict of interest. But this is an important point that I want to make. The same conflict of interest applies to insurance companies in managed care and the federal government in socialized medicine. For insurance companies to be able to improve their financial situation at the expense of the patient is an unacceptable conflict of interest. It's likewise unacceptable for the government to save money by limiting spending on patient care under socialized medicine. Only the patient has the right to a financial incentive for limiting expenses. This can safely be accomplished by a cooperative arrangement between the patient, the doctor, and the insurer. Patients can be given the power to make as many decisions as possible within safe parameters prescribed by his doctor. And patients can be given a financial incentive to be thrifty while being protected by their insurer from excessive healthcare expenses. This is what I call the Vernier model of healthcare delivery. Under this model, insurers will issue consumers a debit card used to pay healthcare bills. They would create a database of healthcare goods and services so consumers can easily compare price and quality online. And they would give patients incentives in the form of a cashback bonus versus co-payments to choose the best value in healthcare goods and services from those listed on the online database. Insurers will also give physicians a financial incentive to prescribe more than one treatment option whenever possible, and to help patients access the healthcare database from the doctor's office. The patient might receive a cashback bonus of maybe 20% of any money saved over the average cost of treatment for their condition, and the physician might receive an additional 5% of any money saved to compensate his time for prescribing more than one treatment option and allowing the patient to access the database from his front office.